that that dormitory is cleaned. The students who are already suffering from that disease are isolated from others. And as they are isolated, they are also treated. Okay? Because isolating them is not enough. You have to isolate and treat. Then now, if that is the intervention mechanism, then now how do you ensure that that happens forever? Because you don't want the challenge to recur again at some point. Okay? So then how do you do it? Maybe you put in some rules, for example, that when parents bring their children from home, maybe the school nurse could be helping to check which student has which challenge so that they can be subjected to treatment before admission. That will be the implementation. You will have identified a problem and through the public health approach, gotten to a response. This is not just for people who are in the health sector, but it's for all of us. Because as you realize in the example I've given, is for a teacher who could be teaching anything, okay? Or it could be for someone who is working in the county. So all these steps, they don't necessarily mean that you must be with someone who works in a hospital setup, because everywhere we are society, we are community. And if one of us has a challenge, then it is likely to, even if you are not infected, we say you are affected, because we work as a community, we work as a society. And for all of us to be largely productive, it means all the team players must be able to work at their maximum. Okay. So we will now try to look at what are the functions of this public health issue? What makes public health to be far much better than, for example, an individualized approach? Okay. So one of the functions of public health, because with public health, you are looking at the wellness of an entire community. And you cannot have a community without having individuals. Okay, so it means that the individuals have to be healthy first before the entire society can be healthy. The unit is about HIV/AIDS, which is largely sexually transmitted. If you have, for example, you have a boyfriend or a girlfriend, which I think most of you do, then you constantly realize, for example, that either you as the man or the lady, you constantly suffer from a continuous infection. So you have an infection, you go treat, the next week you have the same. After 1 month, you have the same. So clearly the problem is not you. The problem is there is a source that after you treat, you are still going back. So then you stop treating yourself and try to ensure that the source of that infection is what? Also dealt with. Okay. So in that case, it's not just about your health, but it's about your health and the health of the other individual whom you are always intimately related with. Okay, so that is equally in that case is not about your health, but is about the health of both of you. So that is equally a public health issue. Okay, we talk of being faithful, for example. So in a way, you are trying to stop the transmission to the larger population, and that is an entire society. So one of the functions of public health is Don't worry about the notes. I'll organize and be sending to the class reps and they'll forward them to you. Okay. So public health deals with surveillance. So you are trying to monitor, okay? You are trying to monitor the health status within a particular population so that you identify the problem. Okay. So one of the public health functions is surveillance, analysis, and evaluation of the population's health status. So in that case, you are continuously Okay, we let's try and continue. I'm sorry, we had a challenge with internet from our side. We had a challenge with internet connection from the university here. So we had a look at exactly what public health is and how it's different from just any individualized healthcare provision. Because with public health, you are not interested in an individual, but you are looking at how you can ensure that the entire population or community remains healthy. And you do that both using efforts or interventions from both science and art. In the end of it, you end up organizing that particular society to have efforts to ensure that the improved health is sustained for a long time. We had defined health as not just the mere absence of disease, but a state in which someone is completely physical, mental, and socially in a state of well-being. So if you're in a state of well-being from a physical, mental, and social status, then we can say that in that setting, then you are a healthy person, but not just the mere absence of disease. So then we understood, or we agreed, that public health then aims at creating the right conditions, those right conditions in order that the state of health for a particular society is attained, which is the correct state of health that is attained and maintained for the benefit of that entire society. You might have seen that anytime you are sick or when you are stressed, then you don't provide or you don't work to the best of your ability. Your state of delivery is compromised just because maybe you are not sick necessarily, you don't have malaria, you don't have any cough, but you are just stressed. So for you to deliver in a maximum state, then you need to be completely in a state of well-being from your physical perspective, mental perspective, and social perspective. So it means that the society which you live in still affects all those three facets of your health. Physically, does it provide any physical danger? Okay, barabara iko na mashimo, ama anything that you can touch on in your office. How is the desk you sit on? Okay, then mentally, what do you continuously hear from your friends? Socially, how are you? Do you have a social backup that you might have seen that children who are born from born and raised in an environment that is toxic, they end up not being at their best. So the environment does not confer any physical danger, but that's just that social danger is what eventually compromises their productivity. Okay. So it means even in the university, for you to attain your maximum state of academic excellence, as you will want to, you have to ensure that you are physically healthy. Mentally, what do you continuously hear? Which type of friends do you keep? And socially, what determines your behavior? What counsel do you get? So that even at the end of it, then your success or delivery is maximized. The difference between public health and any healthcare, individual or the medical provision is largely from a focus perspective. So you can, the focus in a public health sector, the focus is on the population or the community that you are concentrating on. In the case of this unit, for example, if we talk of the Kibabi University community or the people who are found within Kibabi University, then the aim for public health is prevention and promotion. So you prevent disease. You don't want diseases to occur before you begin to struggle with the treatment, but you have to ensure that they don't occur. So you can think of public health. If you have a door, if you have a house, you'll put a gate and have doors. So the aim of the door is to prevent any unwanted person from coming in. The aim of the gate is the same. Okay, so you are preventing any unwanted person from coming in. And that is the whole essence of also public health. We want to look at more about prevention. We had seen the approach for public health where you ask yourself, what is the problem that this particular population or community is encountering? We had talked of, for example, if you are a teacher in a school, then you are in charge of a particular dormitory. You are the boarding master or boarding mistress. Then you realize that a significant number of students in that particular dormitory begin to experience a particular health challenge, for example, a skin disease. So you realize it's only from this hostel. That is the problem. Then now you ask yourself, what is causing? Why just particularly from this hostel? So you try to identify the risk factor. Once you identify the risk factor, if they are particularly just from a particular hostel, it could be that there is something within that hostel that is infecting them. So then you've identified the problem, which is the skin disease. You've identified what is causing it. You realize that it's possible that something from within this class, this particular dormitory is affecting these students. Then now you ask yourself, what is the intervention? How can you intervene? How can you ensure that whatever is affecting them is thwarted, is stopped? So the intervention, you will recommend wakuje waoshe that entire dormitory. Then the students who are now suffering from that particular skin disease to be secluded, then treated. Then now you bring in an implementation. How do you implement this for posterity? You want to ensure that no other student suffers from that. So what you do is now you come in with mechanisms and maybe recommend that every parent who comes with a student for admission should be checked for a skin disease or any other, so that you stop such health challenges from attacking any other child within the school. Okay, so you do surveillance to ensure you find the problem. You analyze to find out what is the risk factor, what is causing this problem. After you've found out that, and then you ask yourself, how can you intervene? How can you ensure that that problem is stopped? After you found out how you can intervene, for example, then for posterity, how do you work with it? It's the same thing for those who are doing computer. You maybe realize that you are supplying computers and people who buy from you eventually end up complaining of eye problem. Okay, so it could be then that there is a problem with the type of computers you are supplying. That is the problem. Then now you ask yourself, what could be causing that every person who buys from me eventually ends up having a challenge with their eyes. So what could be causing? Is it the amount of light? Is it any emission from the computer that you are selling? Once you've identified that challenge, then now you ask yourself, so how can you intervene? Can you get something to be covering that monitor for every other person who uses that type of computer? Because you will have now found an intervention. But then going forward, you might not be able to sell continuously those covers. But how do you stop? Talk to the manufacturer, or if you are the manufacturer, and then find ways of ensuring that whatever is hurting people's eyes is removed from the type of machines that you sell. So you are not looking at any particular person, but you are interested with the people who end up using the services that you are offering. Okay, it could be the same thing with your mama mboga, and you are selling watu wananunua mboga kwako, and they end up having health challenges. So the importance of public health, why is it important? Why is it important? It is important that public health helps us to identify the problem. We were talking of asking what is the problem, okay? So once you identify what is the problem, it means public health will have helped us to do the surveillance bit. For us to do surveillance, for us to understand what is ailing, which challenge is a particular population encountering, you only find that from a surveillance that you'll have done. Surveillance is about evaluating the population status of the health status of a particular population. So you want to understand, why is it that these people are suffering from this challenge? Why is it that they have a cough? Why is it that wale watu wenye fundi, wewe ni fundi wa viatu, ukiwashonea kila mtu anasema mguu ya right inauma? Inamaanisha unawacha uzi ndani, ama unawacha shindano ndani, ama unafanya namna gani? So you want to monitor, you want to evaluate and have an understanding of what this particular group that you are interested in is suffering from, okay? So you eventually then, because of that surveillance, you eventually then begin to understand the health challenge that that particular population is encountering, okay? So it is only after you've understood that now you can think of coming up with how you stop that particular problem. You've done the surveillance, you've done the evaluation. Ways in which you can stop, one of them is by developing policies. Okay, so you come up with policies or plans that can help to support the health either of the community or the individuals that make up that particular community. In terms of policies, hapo ndio unaona wanasema kwa mfano ukivuta sigara usivutie pali fulani. Okay? Kama ni pombe wanasema usiuzie pombe karibu na shule. Those are policies. Kama ni unapanda kwa gari wanasema kama ni kwa pikipiki vaa helmet. Those are ways in which they are trying to reduce injuries in case there is an accident. So by putting on a helmet, it does not prevent you from being involved in an accident. But in case you are involved in an accident, then you don't suffer much harm. Okay? So in the case of, for example, if you are dealing with STIs, like we shall be looking at HIV, you are told to use condoms. That is a policy, that is a plan, is trying to support the health of this particular community. Okay, so, and that is a benefit of public health because they analyzed, understood the cause, then realized that when you do this, then you reduce the health challenges that these particular people will suffer as a result. Okay. So with the development of policies, it's about identifying the effective policies, the effective plans, the effective intervention mechanisms that will help reduce the number of people who suffer from a particular health challenge. In this case, for example, talk of how you reduce the number of smokers within the society. How do you do that? You educate people on the dangers of smoking. Because when people know that if you smoke, this is what you are likely to suffer from, then they will naturally shun away from smoking. So that is also a benefit of public health. You develop policies that are meant to support and enhance the particular health efforts, either of individuals or of a community. If you talk of individuals within a community setup, then you are likely to be talking of people who are more at risk. For example, if you are talking of the commercial sex workers, you develop policies that will help to ensure that these people are not so much of a health risk to the larger community. How do you do that? Tell people that when you are engaging in some of these things, use protection and educate the society against the dangers of being involved with commercial sex workers. So whoever will go ahead and be engaged will use protection, but others will have their behaviors changed as a result of the what? Their plans through the teachings that you are subjecting the population to. The other function of public health is about health promotion. So with this, you are trying to educate the population about how it is important, how advantageous it is for people to keep off certain risk behaviors that will subject them to the likely predisposition or likely suffering from a particular disease. So you tell people, for example, if you have to smoke from designated areas. If you drive, endesha ukikuwa penye watu wengi wako, drive maybe at less than 50 kilometers. And you end up telling them why it is important to do that. So that you will no longer be in every car trying to tell them punguza speed. But once they've been educated enough, then by virtue of the continuous education, these messages are now part and parcel of the entire population. So with health promotion, you have interventions that are coming up even from mass media. You remember the COVID times, walikuwa wanaweka hizo advertisements kila mahali, up to and including the vernacular radio stations. So you will listen it from Sulwe all the way and watch it in KTN. Okay. So with the health promotion, you are trying to engage every other person up to the lowest in the language that they best understand. Okay. So it is about raising the awareness, campaigning to raise the awareness in a particular society of the dangers that that particular society is exposed to. So once they know those dangers, once they know that if you smoke, this is what you suffer from. Once they know that if you drink alcohol, this is what you suffer from, then people will now begin to make up conscious decisions to avoid certain behaviors so that they can promote their own health. Remember, it's still public health, so you are not targeting a particular person, but you are targeting the entire population. And what you are targeting is to ensure that you reformat the behavior of that particular society. Okay. You are looking at how do you change the thinking of this particular society. Then the next importance of public health is disease prevention. So how do you prevent a disease, for example? We've had this vaccination drives that have been all over. You are told to take children for vaccination. For the our dear sisters in the class, they are now rolling out vaccinations for a particular virus that will bring about, I think, some sort of cancer that is specific, that attacks only women. Okay. So when you do that, when you undergo such vaccinations, and as it has come as a result of efforts within the community, people telling you that if you do this, then you will likely not suffer from this disease. Then it means they don't wait for you to have the disease before they tell you to go and seek treatment, but they tell you that if you do this, you will not, your chances of being infected with that particular disease will be reduced. Then you are trying to prevent. And as the saying goes, prevention is better than cure. Okay. So with the prevention, there are two approaches. You look at the high risk approach. So these are individuals that are highly predisposed to a particular illness. Okay. So you look at, if you are, for example, looking at a particular disease that comes through blood infection, for example, you ask yourself, within this particular population, which group has a higher predisposition to this particular disease? It means who are the people within the population that, for example, are exposed to blood? So does this person work in a health setup? Is this person a driver? Because wanaweza pata ajali kwa barabara and blood will spill all over. Does this person work in a blood transfusion center, for example? So such becomes a high risk group. So the approach, the way you look at this, the people that are at a higher risk is different from the way you look at the general population. So the people that are at a higher risk for a particular disease in question should be given first priority. When you are dealing with road safety, you want to reduce road carnage. There is no point going to the village and dealing with people who hardly travel. The people you'll have to focus on are the people, the drivers, the border riders, the people who are always exposed to the roads. So you teach them the rules of the road, you teach them the safety mechanism, ensure also that they know a bit of first aid, because those are the people that will come into first contact with people who will have suffered the consequences of an accident. With the population approach, then you are looking at a whole population without focusing on a specific group. The high-risk approach, you are looking at people who are highly predisposed by virtue either of their health status or employment, okay, the nature of their work. In a population setup, then you look at everybody in an equal proportion. You remember for COVID, when the vaccines came, they had to begin with the healthcare providers because those were the high-risk population. Then they now went to every other person. Okay, so with the disease prevention, you give it that approach. Begin with the highest, the population at the highest, the group at the highest risk. Then once you've dealt with them, then go to the general population. It's the same thing with the vaccination. Okay, it's the same thing with vaccination. That's why they give at times preference to, for example, young kids and pregnant women. Before now, they go to every other person because young children and pregnant women have a higher risk to some of those health challenges. Okay, so still, that is the importance of public health. And it is dealing with disease prevention. Now, the levels of this at which we can prevent the occurrence of disease. One is you can intervene before the disease appears. We call that primary intervention. So there is no disease, but you are just trying to imagine what if the disease occurs. I began by giving an example of the doors we put on our house. You put a door even before a thief comes. You put a gate on even before the thief comes. That is the primary intervention. You are trying to deter any possible intrusion. Okay? That's the primary intervention. So you bring in mechanisms that will ensure that the appearance of that disease, the occurrence of that disease, its chances are reduced, if not diminished. Okay, and that could include, for example, vaccinations, drinking of clean water, okay, ensuring that the entire population is not exposed to a particular disease-causing organism. You are trying to bring in mechanisms to ensure that this population does not suffer from the disease. But there are instances where, however hard you try, you will realize that a significant portion or a small number of the population maybe still end up suffering from the disease. So then you now have to move from a primary intervention, a primary prevention level, where you are trying to ensure that there is no disease. You are intervening before the disease appears. At secondary prevention now, you are intervening before the symptoms are manifested. So you want to stop the disease before the actual symptoms can be seen within the population. So when the people who have been infected are still asymptomatic, they've not expressed their symptoms. Okay, so still that is, you are preventing the occurrence of disease. But at times, these two might fail. You might fail to intervene before the disease appears. You also might try to stop the expression of symptoms, but you realize that there are symptoms within the population anyway. So then that makes you to move to the next level of prevention, which we call the tertiary prevention. So at this level, you are now intervening when the individual is already ill. The person already contracted the disease. This individual has expressed the symptoms. And now you can look at the person and say, this person is ill. So if you are talking of maybe a waterborne disease, it means people are already diarrheaing in the entire population. So those people have expressed the illness. So what do you do now at this level of tertiary intervention? You mitigate the effects of disease. So if people are vomiting and diarrheaing, then you begin to offer now the first aid bit, offer fluids to ensure that they keep hydrated. So you can no longer prevent the disease. It is already present in the population. If someone begins vomiting in the office, that is now what you need is a tertiary intervention. Because huyo mtu ni mgonjwa tayari, you cannot stop that person from becoming sick, but you can only try to reduce the effects that that disease that the person is suffering from will be having on that particular individual. Okay, so those are the three levels in which we can look at disease prevention. Primary intervention, where you have to ensure that the disease does not appear in a particular population. If you are successful at that level, then that will be good. But at times, it is not necessarily 100% successful. So you go to the secondary level, where now the disease, you realize a few people might be infected. But now how do you intervene before the symptoms manifest in the population? Okay? Because when people now manifest with the symptoms, they are now highly infectious. So if you stop the manifestation of the symptoms, then you stop these people from being infectious, being dangerous, being a risk factor to their immediate neighbors. In the event that you are not able, then you have now to look at the next level of prevention, which is the tertiary level. At that level, the person is already sick. You can see the manifestation of the illness. The person is bleeding, So how do you deal with someone who is bleeding? So that is where the first aid aspect comes in. And it will be important for most organizations to always have like a first aider with someone trained to offer first aid in the offices, irrespective of which type of office it is. So there should be someone at hand to offer such services to the population. Okay. So the other function of public health is to develop effective programs and health facilities to protect health. So the programs will be important in promoting health of the population. Okay. But now you realize that with the programs, we are dealing more with prevention and ensuring that the people within this particular setup do not suffer from an infection. But in the event that they suffer, then they will need a health facility. So public health will not only develop a program that is effective to ensure that the people within that society don't suffer from some health challenge, but in the event that they suffer from the health challenge, then there should be a health facility. An example I will give is in most of the bathrooms or toilets around, you find condoms provided. So they are provided to help you people when you are engaging in all manner of love issues. But there is nobody to tell you that before you go intimate, please use this condom. So that is a program that has been rolled out by the public health department of the university. But still, the condoms are provided, but equally there is a clinic, so that kama wewe you will end up not being prevented by the programs, the condom provision program, and you end up suffering from an STI, then you can now go and be treated at the health facility. Okay, so these programs, they are aimed at promoting health. And most of these programs are based on scientific evidence that when you do this particular thing, you are likely not to suffer from a particular health challenge. But because not all people are disciplined enough, or there will always be some unique persons within the society who will not be ready to follow the laid down programs to ensure that they don't suffer from the health challenge, there must be now a health facility yenye itakusaidia kama hautakuwa umesaidiwa kutokana na the health program. Okay, so that is an example. Okay, so the next function, we've seen that there are policies, there are plans, there are programs that can be developed. But these programs huwa zinapitwa na wakati, so they have to be evaluated over and over. Okay, so people have to sit and ask themselves, how successful are the programs that we had rolled out? How successful are they in the ensuring that the population that we had targeted is kept healthy? So there must be a continuous evaluation. So you implement these programs, but then after some time, you keep checking how these programs are performing and try to associate, are they leading to an improvement or there is no significant difference? So the importance of this continuous evaluation, it helps the people who are within the community, the policymakers within that particular society, to either enhance the same policies, strategies, or even facilities. Because at times you might realize there are people who need a particular health treatment from this particular facility, but they don't have that, they don't offer it, sababu hawana a particular machine that can help in offering it. So then it means after evaluation, wakiona watu wengi walitaka kutibiwa na hii, na hiyo kitu hakuna, then now the policy makers might make a deliberate decision to go ahead and procure such a facility to improve the health provision from that facility. For the policies, they will ask themselves, for example, we are providing condoms. Do we still have unwanted pregnancies? Do we still have students suffering from STIs? Okay, so they will look at the data, not only at the university clinic, but maybe even from around, to ensure that, does it mean the condom provision strategy is working or not? Then if it is not working, how can we make it better? How can we ensure that it works? Should we bring in counseling so that we don't just provide condoms alone, but we counsel the student population and tell them, don't do this, don't do that. Okay. So this function is about looking at what is provided and how effective is it and how can it be made better. Okay. How can it be made better? And it is not necessarily something that is left for just healthcare providers. Everybody is part of this, because you benefit from these policies, you benefit from these facilities. So it is you to say, when I go to the university clinic, I wanted this test, but it was not there. I wanted this particular test, but it was not provided. So when the evaluation is done, and that's why you have all these suggestion boxes, when the evaluation is done at the end of the year, they can realize that most students wanted this particular help at the university clinic, but it was not provided. So we need to procure this facility to ensure that this number of students, this cadre of students, are now taken care of. Okay. At times, even it could need some political intervention when you are dealing, because health is currently devolved. So you might need to bring in some of your local politicians if it's back in the village. Those are some of the opinion makers. Okay, the people who determine the opinion within a particular society. So you bring in either your MCA, your MP, tell them tukienda kwa hii health center, wamama wakitaka maybe hiyo dawa ya hii wanaekelewa ndani, so that they don't, for family planning, maybe haipatikani, that they have that particular drug also procured, so that people continue benefiting from it. So in essence, we've looked at quite a lot of all what public health means, the steps in public health, and the benefits of public health. We've seen that public health is no longer about an individual, but is about the population, is about the community. The understanding is we live within a community. And when you are healthy as an individual, you cannot be productive because then you live in a society. Wewe ukiwa uko mzima na mama ni mgonjwa, your mother or your brother, you either will not work perfectly, or the little money you have now to support these people when they are being treated, which is not a bad thing. But if you can help them to prevent the occurrence of that particular health challenge, then why not? So that is the whole essence of public health. Public health, it is not necessarily about drug provision. It's just about behavior modification. It's about behavior modification. And that is now why it is such an important thing to consider. It's almost 10. I'm sorry that we lost some minutes because of the internet issue, but we were to stop at 10. So I will want to believe that we can stop our lecture there for today. Then we will continue next week when now we begin looking at HIV/AIDS proper. Okay, I will organize for the notes, then put them on the university online learning platform where all of you can then download and access them. So thank you very much. Someone has raised, James has raised, James, continue. Unmute yourself, James, and ask. Okay, I think labda alibeba mkono kimakosa. So I'll end. 2 participants have raised their hands. If you can't ask a question, please just type. I'm reading. Okay, people, Naomi, we have a problem of reporting units. Any other? If you have any challenge, enrollment key. Sharon, mebeba mkono. Okay, I will deal with this. I think the main problem is with enrollment, right? Yeah, I think the main problem is with enrollment. That will be dealt with. And I hope by the next, someone is saying that if I can just send the notes, the class reps, reporting imekata, even enrollment. Yeah, we'll deal with that. So worry not, we'll deal with that. Okay, so let's end the lecture there. We'll pick it up next Monday. But since then, someone is sharing the enrollment key, which is KUC1230 Jan 2024. Beryl is sharing it with everyone. I've seen Clinton also doing that. So for the ones who are asking for the enrollment key is being shared. Please copy it. KUC1230 Jan, that is JAN 2024. That is the enrollment key. So copy that, then know that that will be your enrollment key for this. If you have any other challenge, get in touch with your class rep, then they hopefully should sort you out. If not, then they will get in touch and we will also help you. Okay, so bye for now. Tukutane Monday.